Hi, and welcome to Beauty Curious. My name is Dr. Elyse Love, and I am a board-certified dermatologist.
And I'm Michael Crumm, a licensed esthetician.
Ian and I are excited to become your trusted beauty guides, from interviews with the best and brightest names in the industry to sharing our favorite expert-approved products.
We are here to help you navigate the noise by giving you the facts. Are you feeling beauty curious? Let's dive into today's episode. Hi, beautiful people. Welcome back to Beauty Curious. I'm Michael Crumm, and I'm here with my beloved co-host, Dr. Elyse Love.
Hi, guys.
And we are doing a quick but very educational show today on melasma.
Yes.
This is a topic that so many of you have requested. So Dr. Love and I are very excited to jump in, and special shout out to our mutual friend, Sarah, who has begged us both for this episode at least 5 times, maybe a dozen. So thanks for being a podcast super fan, Sarah. And with that, I'm going to pass it to Dr. Love. Good morning.
I am so excited to talk about this topic because I feel like melasma is one of those things that is so frustrating to people. And it's often frustrating just because they don't understand what's in their control and what's not in their control. And I find that when people are finally like, oh, then people are able to like find the routines that work perfectly for them and they feel really in control of their melasma. So yeah, let's just like get right into it.
All right, Dr. Love, let's start at the baseline. We're at University 101.
Yes.
What's melasma?
Yeah, so melasma is the skin condition that presents with pigmentation or dark patches. And those dark patches are usually symmetric and they're usually on the face. They can happen on the forehead, right above the brows, on the cheeks, or the upper lip. Those are the most common areas. Some people have multiple of those, some people only have one of those, but that's essentially what melasma is. Unlike other skin rashes, melasma doesn't itch. It's not red. It doesn't really draw attention to itself other than the fact that you're all of a sudden like, what's going on? My skin, it's not as even as it used to be. And so a lot of times it can be very sneaky for people because they don't even realize that they have a technical skin condition or a skin rash.
So what causes melasma?
Yeah, so melasma is complicated. So what we know is that there are about 5 factors that contribute to melasma, and some of them may be a trigger, some of them may make the melasma worse. But the 5 potential triggers of melasma are: 1, hormones. So first off, melasma is much more common in women than men. It's just like there are a few men, a small percentage of melasma patients who are men, but most are women. And even beyond that, a lot of women will say that their melasma started while they were taking oral birth control that contains estrogen or while they were pregnant. So melasma actually used to be called the mask of pregnancy, and that's because it was so common or so commonly presented in pregnancy. The annoying thing is when you're no longer pregnant or you're no longer on the birth control, your melasma doesn't go away. It might get better, but it doesn't just magically go away. The second thing that a lot of people understand is sunlight. So we know that sunlight drives pigmentation regardless, right? Melasma is extremely sensitive to the sun. And so people who live in high sun environments have a harder time controlling their melasma just because it's so sensitive to UV radiation. The third thing is heat. And so that often goes hand in hand with sunlight. So if you think about a beautiful day in Florida, it might be 80 degrees and super sunny. That's like terrible for melasma. But we actually saw during the pandemic that people's melasma was worsening. They were like, I don't understand. Like, I'm not getting that much sun. I'm always wearing a mask. How is this possible? And it's because the heat from just breathing into the mask was worsening melasma. This can also be for people who work in kitchens, just because there's so much heat throughout the day that they're being exposed to. Or even I think about it all the time when it's summer and I'm going down to the subway, hot.
Oh, yeah.
Yeah, that actually can be a trigger for melasma.
That could be super tricky for someone who is super diligent with sun safety, like myself, that's on the beach and feel like they're completely covered, but then the heat could flare it up versus like they're slathered in sunscreen and UPF clothing.
That's exactly it. And that's one of the reasons people feel so frustrated with their melasma because they're like, what are you talking about? Like, I'm protecting myself from the sun. Like, why is it getting worse? And then when you're like, oh, it's also the heat, you're like, oh, I have to be more proactive about more than one factor. Another one for us New Yorkers, pollution. We're learning
Mm.
more and more that pollution irritates the skin, and anything that irritates the skin can drive pigmentation, particularly melasma. And then the fifth one is just in general irritants. And this is sometimes where people who are treating pigmentation in general get themselves in trouble, but particularly melasma is that you can't overdo it. So, like if you try to use the strongest retinoid, the strongest vitamin C, all of these products, you can irritate your skin and you're actually driving your melasma by irritating the skin. So it's like, I
Ah.
know it's like one of the hardest things I have to get my patients to understand. I'm like, we have to go low and slow, but when we get you where you want to be, like we'll be able to maintain it.
I think low and slow is such a good skin philosophy for
Yeah,
everything.
I agree.
So, all right, so we have someone, you have a patient, sadly, they are dealing with melasma. It's really
Yeah.
affecting them emotionally. They're frustrated. What's the first step? How are they going to get it under control?
Yeah, so with melasma, I will break treatment up into two categories. One category is what we call like our acute or like, what do I call it? Okay. So I divide melasma treatment into two categories. One is going to be our quick action. So that's when your melasma is flaring and you want to get it under control quickly. And then the second is your maintenance. So the things that you're doing in your routine every day to minimize how often you're getting a flare, and if you get a flare, how significant it is. And so for quick action, this is actually where hydroquinone is kind of a shining star. There's really no topical that works as well as hydroquinone in quickly improving melasma, meaning that like within a couple of weeks, you can start to see some improvement. Hydroquinone is not something that we use long term. So for my patients, we don't use it more than 12 weeks. And so we usually do like an 8 to 12 week course where we're taking their melasma down, maybe even quicker if they, caught it super quickly. And then once the melasma is down and it's calm, then we switch over to maintenance. And the really nice thing is there are actually a ton of melasma maintenance topicals now, which like can be nice and also can be frustrating because I find that everyone's melasma like needs its own little cocktail. It's like melasma and perioral dermatitis. It's like there's no standard formula for those. It's like everyone's skin just wants what it wants.
That's why you have to see your derm and get it under
Yeah.
control. Is there a specific reason for the 8 to 12 week program? And I've heard of different percentages of hydroquinone. Is there like a preferred percentage, or that's also part of someone's individual cocktail?
Yeah, that's a great question. So with hydroquinone, the reason for the 12 weeks is there is something called ochronosis. Ochronosis is paradoxical darkening of the skin. And so there's been multiple documented cases where people have used hydroquinone for long periods of time. Usually it's like months to years, but we like to be super conservative. They can actually, with this long-term use, especially if it's high dose hydroquinone, you actually can get this darkening that looks worse than melasma, and that's really, really difficult to treat. So that's why, as long as we keep it on that 12 weeks, it's nice and safe, almost an equivalent break from it, at least a couple of months from it before we repeat. And then you are correct in that melasma, like over the counter, hydroquinone is like 2%. I don't think it does very much. And I think that when you're using such a low percentage, you're much more likely to like persistently feel like you need it. It just kind of like
Mm.
maybe does a little,
Hmm.
but not enough to be effective. And then you don't stop it in time. And so I hang out around 4% most of the time. We actually carry a formula in our office that's like specially formulated to be designed for sensitive skin. But there are some compounded versions that are 6%, 12%. The one thing with the higher percentages is that you have to be careful that it doesn't irritate the skin because hydroquinone can be irritating. And then the other thing is hydroquinone lightens whatever skin you put it on. And so sometimes with the
Mm,
stronger percentages, people can start to notice this like halo effect where the skin around the melasma actually gets lighter. So then
mm.
you're like have three things going on. You have your normal skin tone, you have the lighter skin tone, and then you have your melasma that you're treating. So the higher percentages can be used, but they have to be used for like the right patient at the right time. And then sometimes I will combine hydroquinone with like a retinoid, and that also works really well as long as it's not irritating to the patient.
Awesome. Thank you for explaining that. This is a podcast. We're not Uber, but I'm still going to ask you to give us a 5-star review after listening today. Thank you. I'm always preaching sun safety to my clients. I'm like, you
Yeah.
better put a visor on if you have melasma. Don't be going in the sun, like all this stuff. So now we have the patient and their melasma is under control. What's their next step? What can they expect, like when they're in this maintenance
Yeah.
kind of phase?
Yeah. So for maintenance, the good news is there's tons of topicals. It takes a little trial and error to find everyone's perfect melasma. One of the things that I found is that a lot of my melasma patients have really sensitive skin. Once we hit our 30s, the skin becomes a lot more sensitive. And so it's a little bit of trial and error to find the perfect topicals, but we know that noids or retinol can be very helpful. Vitamin C can be very helpful for just evening out the skin tone and helping with pigment production. Skin Better actually makes this topical called Maestro that they don't even market it for melasma. It's like marketed for like skin balancing. But I think that's why
Mm.
it works is because melasma, all of these like small irritants that are coming in contact with your skin, I find that it really helps calm my melasma patient's skin. So Eucerin just came out with this radiant tone, which is super exciting because the active ingredient has actually been in Europe and Asia for the past 5 years, and it's like the number one treatment for pigmentation. We finally have it in America. So I've been testing that out a ton. And so I find that using products like niacinamide and like the Maestro, things that are soothing to the skin, balancing that with things like retinol is very helpful for maintaining maintenance with melasma prone skin. Sun
What about,
protection. So, like as you
oh,
mentioned,
yeah.
SPF 50, and then not just sunscreen, as you mentioned, hat. Like if you're going outside and it's spring, summer, you should have a hat on. Like you should be covering your face. That's really important.
Yeah, hat or the visors. There's
Yeah.
so many options. All right, what about other advanced treatments? I've performed peels sometimes on clients. There's
Mhm.
also so many different lasers on the market. Is there anything there that you recommend?
Yeah, so anything that can be helpful for pigmentation will be helpful for melasma in general. So superficial peels can be really helpful, essentially just speeding up the recovery. We know that there's two different types of melasma. There's what we call epidermal melasma, which is more superficial, and then there's dermal melasma, which is deeper. And so peels can be helpful. Most people have both, so it doesn't matter that much, but peels can definitely be helpful for that superficial component. Lasers used to be like an absolute no for melasma, but there's actually some newer ones like Clear and Brilliant and Laser Genesis that are helpful, especially for that deeper melasma. You really want to stay away from things like Fraxel and Halo, and that's because in addition to lasers are light, and so light triggers melasma, but lasers also create intense heat. So anything where your skin is getting super hot is going to flare your melasma. So sometimes people will say like, "Oh, I did this laser treatment and I noticed my melasma got better." And then 2 weeks later, their melasma is like way worse than it was before. And it's actually the heat from the treatment that triggered their melasma. But with everything that you do procedure wise, again, it's still going to be that low and slow. Like you want to be super conservative, super soft with melasma skin, keep it very cool, and make sure that you're not irritating it and pushing it too much.
I think we should double down on the heat comment because it just made me think of how popular, I love going to an infrared sauna,
That's such
love
a
the
good
heat,
point.
and it's kind of like fits very much in the whole wellness movement right now, but that is super hot
I
and
actually have
I'm,
a patient who we finally figured out that it was her sauna visits that were
mm,
triggering her melasma. Like she was just like, I don't know what's going on. Like my melasma, it just like randomly gets much worse. And it was because she was starting to like add the sauna into her routine. So yeah, heat actually is really important. Do a cold plunge instead. Same results.
Yeah. So, as much as I'm always preaching, get to your derm, get all this checked out, I want to be cognizant that not everyone has immediate access to a derm and they might be searching for solutions online. There's a lot of misinformation that circulates all the social platforms and confusion. So, Dr. Love, if someone is waiting to see their derm and they're trying to find a solution, what are some products that you really like? I know on TikTok the A313 product is like all over the place. What are your thoughts on like top over the counter products people could consider?
Yeah, that's actually a great question. And the really exciting news is that actually most of the things I recommend for melasma are over the counter. So obviously it's helpful to have a dermatologist guide you through which, starting points of where to start, where not to start. But I think if you're going at it by yourself, that I like starting with things that are not irritating to the skin and soothing to the skin barrier. Because again, remember, it's not just sun and heat that's driving melasma, it's also irritation. And so if you overdo it with retinoids like your A313, you can make things worse. And so I love niacinamide. I think it's a really great ingredient. In terms of niacinamide containing products, I love the La Roche-Posay Mela B3 Clear. And also PCA Skin has like my favorite niacinamide serum. Saran just released a new topical called Radiant Tone. It's been in Europe and Asia for the past 5 years. Like Eucerin actually flew me to Germany to like meet the scientists and look at the data, and the results are insane. So like that is, if you're going to start with one product, I actually would say start with that. But the nice thing about those products is that they're not irritating to the skin at all. So they're going to help with your melasma, but you're not worried about overusing them and not using them correctly. And then, of course, retinol is very helpful. A lot of people like A313 because it's gentle on the skin. It's like a very gentle retinol. I don't love recommending things that aren't made for the American market. Retinol can be really helpful, but you want to start low and slow so that, start once a week and then slowly build your way up. But if you start to get any dryness, flakiness, that's your sign to decrease. Patients should not power through like any retinol irritation. You should always be below that point of irritation.
Amazing. Well, I learned a lot. I hope Sarah, our super podcast super fan, also learned a lot. We love you, Sarah. As
Sarah moved
always,
from Florida to New York and her melasma got better.
there's proof. Well, as always, beautiful people, thank you for listening. Let us know if you have any questions on social, write into us, and we'll be back soon with more episodes. Thank you, Dr. Love.
Perfect. Bye, guys.
Our DMs are always open.
We're always looking for new show ideas.
Ask us skincare questions.
Let us know what you're beauty curious about.
Give us a follow over
At our Instagram, @BeautyCuriousPod.
to see snippets from each show. Thanks for watching.